Thank you very much, Chris and Jason, for having Guam Behavioral Health and Wellness Center again on your show. And good morning, everybody. I hope everybody is safe and sound.
Yeah, absolutely.
This Tuesday
And, Therese, so much has been said, has been written, not just in the last year because of the pandemic, but mental health is such a issue that is so present in society now. Because a few years ago, people said it was made public that a lot of people, whether they know it or not, may actually have mental health issues. People are whether they're conscious of it or not, may be going through depression. People may begin to exhibit symptoms that you might be bipolar, and it really spans the gamut and everything like that. But we will actually undertake all this, as I said, in May, really letting the community know that mental health is a very serious topic, and that organizations like yours are here to help, to provide resources, and to reach out.
That's correct. May, it's the end of April, and, we just want to let the people of Guam know that May is Mental Health Month, and your department, the Guam Behavioral Health and Wellness Center, has an array of activities to highlight the importance of taking care of your mental health. And so we're very excited. I can tell you that we had lots of, we wanted to do a lot more in 2020, but for obvious reasons, the pandemic hit. We were just in the first quarter of the pandemic last year when May rolled around. And so there was not much activity and planning to be done for Mental Health Month. There was a little bit, but not too much, and definitely very, very virtual. So I think it's given us a lot of energy for this year. And so we have a full list of activities for the month of May being planned out. And so, and it starts off always with the kickoff of the recognition by our governor and lieutenant governor on Monday being May 3rd. And that is the proclamation signing declaring May as Mental Health Month. And that's at 1:30, and that's on Zoom. You can access it through the governor's Facebook page. I believe it will be accessed through other means that we will be putting out on a press release. But definitely Monday, May 3rd at 1:30 in the afternoon, our governor and lieutenant governor will officially declare May as Mental Health Month. And so we invite all our partners, our family and friends, everyone in the island that supports us, that supports somebody who's being seen at the department in one form or fashion, to please join us at 1:30 at that proclamation signing, that virtual proclamation signing.
Well, we will be there too, because you've always been a friend of the show here, and your staff have always gone above and beyond. And I mean, it really is a profession that if you can prove to someone that if you want to work at the Guam Behavioral Health and Wellness Center, basically I would say the one big skill set you have to have is compassion and caring, and just an unwavering ability to say, I'm going to help those people that are charged with my care, because I mean, it's not just an 8 to 5 job, to be sure.
And I appreciate that, Jason, and absolutely. And it's a perfect segue to a big shout out to my employees at the Guam Behavioral Health, the professionals, the clinicians, my 200 plus employees at Guam Behavioral Health, who has been working day in and day out. Since the pandemic, we've been considered an essential agency, just like public health and GMH. And so we have not shut down. And through the changes and the challenges of how to go virtual and how to ensure safety and distance, my staff has been exceptional. And I can't thank them enough for just being there for the people of Guam through this pandemic. And so a big shout out to my Guam Behavioral Health and Wellness Center employees. They deserve much more than I can provide for them, but They're the professionals that, as you stated, has the compassion and care. And it's very evident, Jason, because I have a very, very low threshold turnaround of employment. People who get into this field is in the field because they love the field. They want to help people.
They're not just going there so they can claim GovGuam retirement in X number of years. I mean, you do it because it's a calling.
It's the calling, it's the passion, it's the understanding of the mission. They really want to help people. And so what a blessing for me to lead this wonderful staff of leaders of themselves. They themselves are leaders, and they change lives. They're change agents.
Well, Therese,
every day.
Oh, I'm sorry. I was going to ask if you could kind of like maybe quantify it if you can. Like, when the pandemic first started out, we here at KUM, we talked to child psychiatrists, psychologists, people in the behavioral sciences about what might be expected. And, none of us knew what was going to happen from one day to the next. But, people in that line of work were saying, it is going to be a big mental strain. There is going to be mental as well as physical exhaustion. I know when we were talking to you, you were very, very concerned about the suicide rate, just people having, onset bouts of depression and everything like that. In terms of like the caseload and like requests, and, you put out the helpline that you guys have always maintained. How much more in terms of a volume of work did you have to take up last year for mental health?
Since the pandemic hit, I can honestly say the volume of work has tripled. Not doubled, tripled. And so that has, again, with the wonderful staff and, COVID brought a lot of challenges to our island on how we approach things and how we think of things. And one of the things that it has brought to play is this whole Zoom room virtual reality. I mean, this whole Zoom approach. And it's one of the things that after the pandemic, whenever this goes away, whether it's this year, the end of this year or next year, whatever, virtual, Zoom, telecounseling, telework will continue. It's one of the blessings that push the agency into the technology age. A lot of things in the GovGuam departments through the years have been invested in manpower, but always going into getting the department into the 21st century, into technology, has been a slow moving process. One thing that COVID has done, it has forced us to move quickly, light speed ahead in technology use. And so that in itself is a blessing. And so even if COVID goes away and we get to some normalcy, the option of using telework and Zoom for counseling, for sessions, for meetings will still be there. And so that's the one thing I'm very grateful for. It's the one thing that saved us. We immediately, knowing that social distance, remember the shutdown, the early days, March, April, May of last year, that was the critical. But we couldn't shut down because people were literally freaking out because it changed their whole perspective on how to approach life. How do they do things without seeing people face to face? And so immediately our mode of transition was purchase professional Zoom, which is all the bells and whistles and approved by our federal partner, SAMHSA, and get people to be seen through telecounseling. So as I mentioned, we did not shut down. We continued to immediately after March of last year, when the governor declared the need to stay home, we immediately started calling our current client listing, checking on them, making sure they're okay, and if need be, making sure that they know that telecounseling is here for them.
And
And as you
speaking
know,
of that, Therese, one statistic that really sticks out to me, I remember last year when we talked to yourself and your staff, was I believe you said the community helpline under normal
right,
circumstances was maybe used maybe once a day, like on average, but
once a day,
like yeah,
25 to 30 calls a month.
yeah,
And at the height, it went to 550. So you can imagine
which is staggering.
It's almost an impossible, but again, thanks to the very flexible work staff I have, we just move people around. We put more people on the crisis call. We added more numbers that will be linked to the crisis number, which by the way is 647-8833. That always needs to be promoted.
And we
still
do.
up and running 24/7. Yeah, so the crisis hotline was a major portal for us.
Well, may
You
I
can
ask?
call that, right?
May I ask, Therese, like from a standpoint of leadership, and from your vantage point, it's a very popular saying when we talk about like law enforcement, right? When it comes to policing the police, and who does that. With your agency, how do you make sure that your caseworkers, the people who man the phone lines, the people who do the telecounseling, as you said, how do you make sure that the team stays motivated, stays focused, and stays true to the mission, without burning out, or because, and as we've said, this is the kind of material you're taking that it's not really easy to step away from at the end of the day.
Right. So thank you for asking, because self-care is really important. And as the people of Guam was able to retreat to their homes and kind of like regroup and hug their kids, at least in their home, my staff still attend, like many, like the first responders, like GMH public health staff, they still needed to come to work. Unlike other departments that had the ability to stay home and bunker down and kind of wrap their head around, how do I approach this? We needed to do it in a heartbeat. And so remember, our staff are just as scared. We didn't know more than the public knew about COVID, but they still got up and they still went to work and they still chimed in. And so self-care is really important. We really made sure, one of the things that in talking to my management team about in the early days is make sure we're very sensitive to the needs of the employees. We also we're here to serve the people of Guam, of course, and the consumers that we serve, but we also needed to be very in tune with what's happening in our own staff's family lives. If after working so long and they needed to take off or needed a break, we needed to be accommodating. There was no such thing as nobody take leave, we just needed to be very accommodating, very compassionate, very there for my staff. And so between that and ensuring that information is everything, right? So at the early days when everyone was scared, and again, my staff are humans too, and they have kids that they were worried about and family members. I made sure that everything that came down my level, which, was directly from the governor and the lieutenant governor, was passed on to my management, was passed on to who then passed it on to their staff. And so information sharing was key, making sure they knew the most up-to-date information, reassuring them that what we're doing, the masking, the distancing, the hand washing, the hand sanitation, providing them all the PPEs that they needed was there. That reassured them. And training, lots of training, telework training. A lot of people never done telecounseling over Zoom. So there was a great rush to make sure that telecounseling training was provided. That was provided. So between training, listening to your staff and their feelings, allowing them to take a day off if they needed to, because remember, as long as they're okay, then they will perform their job at the best of their ability. If they burn out, I'm in trouble. I'd rather give them a day or two out, to rest, to regroup, than to have them out for a week or two.
And as long as
That's
I've
more
known you,
detrimental.
Therese, I mean, as a leader, you've always expected and demanded a lot from those who are under your supervision. But at the same time, you're very, very fair. And like you said, we literally were all in this together. And most of us that had the information, we still didn't know what was going to go on from one day to the next. So the best thing you can do is just say, if you have issues at home, or you're just you feel like you're burning out and everything, like that, come talk to the boss. But like we're all human beings.
Absolutely. And that's the one thing that I wanted to impart, that my staff, yes, the expectation is great. And yeah, you hit it on the nail. I expect great things, but I'm also a very compassionate leader. But that's just naturally me, but it also helps that I have compassionate leaders that I answer to. And people might say, "Oh, Therese, it's because you work for them." But honestly, Governor Liu and Lieutenant Governor Josh, they were the greatest role models and support, because they too turned around and told the cabinet the same thing. I expect great things, magnanimous things from this administration, but not at the expense of your health and not at the expense of your family. So take care of your families first, and make sure that you're in tune with what's going on in your body and in your home, and only then can you become effective leaders in your department and pass that same compassion on to the staff. So, a big shout out to my bosses, our governor, lieutenant governor, who are great role models of compassionate leaders and strong leaders.
Yeah, Therese, I do want to comment that, as we get into May and we celebrate mental health awareness, I mean, it's so much of your agency is doing, outreach within reason, given that, we've still got restrictions in the community on what we can and can't do. And you guys are undertaking so many different activities, like you said, but at the same time, it's also a chance for us, the community, to say thank you and see Duas Masi and congratulate and celebrate you and your staff for what you're doing. So how can we, as citizens, be able to participate in these activities and have our chance to thank you guys for the work that you've done?
I appreciate that. As I mentioned earlier, this May 2021 I think we got so excited because 2020 was kind of limited. So we have a full array of activities and a lot of new ones. And so if I could just mention some of them again, sure. We invite the people of Guam to Monday. It's the kickoff. It's fitting. It's Monday. It's the beginning of the week. It's the first workday of May. At 1:30, our governor and lieutenant governor will be proclaiming May as Mental Health Month, and that everybody can catch that on the regular Governor Lou Leon Guerrero's Facebook page that she normally puts press releases on, press conference on, and those kinds of public forums. And so that's 1:30 Monday. So we hope that everyone can join us virtually. That is the proclamation signing by our governor and lieutenant governor. On May 5th, we start a art competition call out. And this is for anyone up to the age of 18 and in any medium, whether it's crayon, watercolor, markers, they would have to put their name, their age, and their grade at school. And they should submit it to Guam Behavioral Health and Wellness Center by May 14th at 5 p.m. There'll be a panel of judges, and they will be displayed at our mental health fair that will be planned later on in the month, which is, if I'm not mistaken, on May 15th. So the artwork will be displayed, and of course there'll be a competition, and prizes will be provided to the winners.
I love that.
So That's something new. That's an art competition. And so we look forward to a lot of our school age kids that can express themselves through the arts and to take full advantage of that. And we encourage our families to encourage your children to express themselves through the arts. And then moving on May 7th, another very exciting, very new event is children's because May 7th is specifically Children's Mental Health Awareness Day. It is our Kite Festival, and that's taking place at Adelup Grounds starting at 3 o'clock in the afternoon on May 7th. And it's a green kite festival. You come, you fly a kite, social distance. We've invited food trucks
Oh, we are
to
going to be
join
there
that
for that.
event. Pardon?
We are going to be there
And
for
it's
that
just-
for sure, Therese.
Yes. Support the food truck industry.
Yes.
Come down to family. There's enough space to social distance and fly a kite and, enjoy the beautiful island that we have today.
We'll
And
tell you
it's
what,
just
Therese. If we can, let's go ahead and end there because I want to make sure that we can adequately cover everything that your agency has coming up in May.
Yeah.
And certainly the child mental health aspect
Right.
is something that we want to really emphasize, at least for week one. So we'll certainly have you on again to cover that. And I would say, under normal circumstances, Therese, I would say, Biba Guam Behavioral Health and Wellness Center, because this is your time to shine. But if we've learned anything from the past year, you guys have done that above and beyond, and you guys have been a beacon of light in our community for so many. So it's our chance to say thank you to you.
Thank you so much.
Yeah.
One of the things, if I could just quickly run down, May 15th is the Guam Behavioral Health Fair at Agana Shopping Center. Look out for that. May 22 is our virtual 2K, 5K. You have a week to get your exercise in. Lots of prizes for those who, or giveaways, mental health giveaways for those who register. Ribbon cutting ceremony, 3.7 detox unit. You've been hearing me talk about that. We've held off on the detox unit for a ribbon cutting in May because it's fitting. And last but not least, we have May 29th, the Wellness Light Festival, again at Adelup, and it's the opportunity to showcase mental health film related and just a time for families to get down to get together in a safe space out in the open. Again, food trucks were invited, and so you're able to see some films, short films. Again, May 12th is the lunch hour with Peace, our prevention office at 12 noon, and that's very exciting. Our theme this year, I forgot to mention, is Seeing Through Stigma. Seeing Through Stigma, and it's really something that's so appropriate through all that we've gone through as a community, because even though Guam Behavioral Health has tripled the amount of volume of work that we've had since prior to the pandemic, it's okay because that's what we're here for, is to serve the people of Guam. But really, I am so happy that many people have seen the need to just drop the stigma and get the help they needed. And that was very evident in the amount of volume and calls that we received from the crisis hotline. So seeing through the stigma is something to be proud of. We go to the doctors when we have colds, when we have a broken arm, a broken leg, or we need surgery. Mental health is just as important. If you don't have your mental health taken care of, we can't approach life. And life is beautiful when everything is balanced.
We'll tell you what, Therese, we got to let you go because we have another interview on tap.
But guys, just heads up, every Tuesday for the month of May, we're going to have Jib Wick on to talk about different aspects of Mental Health Awareness Month. So there's a bunch of stuff you touched on, Therese, that I'd really like to deep dive into more, for the next few Tuesdays. So we definitely appreciate your time. Proc signing is Monday, and then Tuesday's 8:30 for the month of May. You can tune in here on the link. Appreciate it, Therese.
Thank you so much.
Of course. Yeah.
Thank you very much. And take care, Guam.
Yeah.
Be healthy.
Esther.
Stay positive, test negative.
There you go.
That's
All
what
right. Sounds like a T-shirt.
Thank you very much.
Okay,
Take care. Have a wonderful day.
There you go, Therese Arriola, Guam Behavioral Health and Wellness Center. Again, every Tuesday in May, 8:30, we'll be going in with Jibwick and talking about different mental health awareness issues, from children's mental health to, there was something I want to talk about maybe on any given Tuesday coming up in the month of May, was what she talked about with her staff approaching her about, just mental health issues they might have, and maybe expand on that in the private sector. How many of us in the private sector have had those moments
Yep.
where you're just like, oh God, I can't believe this is happening?
Well, everything that I know people have asked me, and I've had people in the mental health field come up to me and say, if you and Chris and Sabrina and Joser like ever need someone to talk to, because